Good morning, everyone. And I'm doing this class from California. I'm visiting some relatives, so it's early in the morning for me. It's 7 a.m., and I hope everyone is doing well. It's kind of sad for me because this is our last class, and I just want to let everybody know I really enjoyed teaching this class. So let's begin. And once again, I'm going to be recording this, so hopefully we'll have a very good recording, and I'll send it to everybody when the class is finished. And if you do have any questions, raise your hand or write a question, and I'll try to respond. So today we're going to be talking about remedy relationships, which is an important topic to understand how homeopathic remedies work with each other. Some remedies seem to complement, some seem to be antagonistic, and this is something that you should be aware of. We're going to be talking about childhood diseases, which I think is a very important topic. Some of you have children. Some of you are older and don't have children, but you have grandchildren. But homeopathy is just wonderful in children. I know in my office, anytime I am dealing with a mother with children, and I teach them some basic concepts of homeopathy, they just love it. Fevers in the middle of the night, colds and flus, it reduces the visits to the pediatrician, and it's such a healthy way to stimulate the body to become stronger instead of using suppressive antibiotics and harmful petrochemicals. We're then going to review the case, and we're going to talk about the second prescription, what to do when you prescribe and maybe the remedy seems to be losing its effect, or it does not work effectively, and you're looking at a second prescription. We'll talk about that. We're going to talk about the limits of prescribing. Of course, my ideas on the limits of prescribing are changing. When I first started homeopathy, I felt that homeopathy could help any condition. And then after practicing for 10 or plus years, I felt that it was limited. But now I'm kind of swinging back the other way, that I feel homeopathy can help any condition out there, including congenital problems like Down syndrome or severe learning disabilities and things like that. We're going to then go into our materia medica for this course. We're going to talk about levels of practice, the next step for you as a beginning student. What is the next step in terms of what direction do you want to go with homeopathic practice? And last, we'll take care of some questions. All right. So let's look at complementary remedies. These are remedies that work well with each other. And classically, calcarea, lycopodium, and sulfur is a triad that maybe someone will start out as calcarea, then maybe later on need lycopodium or sulfur. It seems to go in a circle. These are called complementary remedies. And why don't we just look at this? If you open up your Borax, and let's see, if you look on page 148, and I hope that our books are matched, but I'm looking at the end of Calcarea carbonica. I'm sorry. On page 147. Typically in Borax, at the end of each remedy, they talk about modalities and relationships. You see at the bottom of 147, I'm looking at Calcarea carbonica relationships. Complementary is listed here. Also antidotes, complementary. Belladonna, rustox, lycopodium, and silica. So those are the remedies that are complementary to belladonna. Then there's another, so the value of this is if you're thinking of changing remedies, or maybe you're given a remedy that just is not working as well as you'd like, look here at Complementary Remedies. You may want to try one of these if it's kind of listed high in your differential. Now we look at inimical. These are harmful or adverse reactions between two remedies. And you can see on the same page, incompatible, which is the same thing as inimical, is boronia and sulfur. Both of these, boronia, sulfur, should not be given after calcarea. There's another classic inimical combination, rust tox and mercury. So let's look at rust tox, and I'm looking for it, the bright page. Okay, rust tox begins on page 552 in Borax, and so you look at the end, and you can see an inimical is apis and complementary. So in other words, you don't want to give apis as a remedy after rust tox, or you don't want to give rust tox after apis. They're inimical to each other. In other words, the energy of the remedies do not vibrate. They tend to work against each other. So that's inimical. An antidote is remedies that actually destroy the action of other remedies, and I really don't have that much experience with that. You can see here rust tox antidotes that anacardium is listed there, miserium, and a couple other remedies, and bathing with milk and grindalia lotion. So antidotes is kind of a type of inimical that will change the action of the remedy. And you look in this section, every remedy seems to have a strong antidote. For example, sepia, the strong antidote is vinegar. Nux vomica, the strong antidote is coffee, and so forth. So use your Borax when you do prescribe a remedy. Make sure that you read, the antidote. So let's go to Nux vomica to see what they have to say about that. And let's look it up in, let's see, Mercurius is there. Let's see, Muriaticum, Natrum. Nux vomica begins on page 450 or 475. So if we look at the bottom of it, we can see relationships. Let's see, inimical is zinc. Antidotes, coffea, ignatia, and cocculus. Okay, so this can be very helpful. The other interesting thing is the idea of acute remedies, and this you can also find this in Borax. For example, belladonna is felt to be an acute remedy of calcarea. So if someone has a calcarea constitution and they have exposure to any type of an insult, whether it's a virus or an injury, they'll respond in a belladonna-like manner. Ignatia is considered the acute of Natrum muriaticum. So you'll find in your studies that certain remedies are acute to each other. Then on the other hand, you also have remedies that are chronic to each other. For example, silica is felt to be the chronic of pulsatilla. So sometimes you'll be using a remedy, treating them, and they'll go to a deeper level, which is the chronic level. So the acute and chronic is a nice relationship to look at when you're using the remedies. Of course, a lot of this is information more for constitutional prescribing or deep prescribing. And, oh, lost audios. Okay, testing. Testing. My audio seems to be working from this end. Do you hear me now? Let me just. Hey, Todd, do you hear me? Todd?
Yes, now we do.
Okay. How long was the audio? Was
About 30 seconds.
Okay.
Was off for about 30 seconds.
Okay, I don't know what happened because it looked good from my end. And I'm here in California. I'm actually in Palo Alto, the high-tech capital of the world. So
Now
I do
don't
have
hear you.
testing. Do you hear me?
Okay, now yep.
Okay. I'm in Palo Alto right now, and this is like the high-tech capital of the world. So if I don't have good internet access here, I don't know what to say. All right. So any questions on remedy relationships? Any questions? In fact, what I'm going to do is I'm going to, let's see, either raise your hand. Okay, I was going to unmute everybody, but I'm getting too much background noise. So I'm going to be muting everyone. So if you do have a question, either raise your hand or type it in. But these remedy relationships are important. You can find all these remedy relationships in Borax. So when you're thinking of a remedy differential or ready to prescribe a second choice, check, see if they're complementary, inimical, look at the antidotes, acute and the chronic. But like I said, more of this will be, you'll learn more of this when you're studying constitutional homeopathic prescribing. Okay, childhood disease. Childhood disease is homeopathy just responds extremely well, mainly because children have not had all the suppression like adults do. And sometimes with children, it's a no-brainer that as long as you're close to the remedy, they'll get better. So I don't want you to think that, for every situation, there's an exact homeopathic remedy. Unless you prescribe the right remedy, you're not going to have a good response. So sometimes if you're close with the child, they will improve. Like, for example, if it's an acute fever and you're debating on whether to use belladonna or aconite, sometimes, no matter what you use, they'll respond. Of course, there is a similimum or there's that exact remedy that they'll do much better, but don't be afraid. The other problem with children is sometimes it's harder to get a clear case. They don't go into the modalities that an adult will prescribe, and they don't go into detail. Sometimes all you may get are just one or two symptoms, and you're not going to be able to get a lot of detail in these cases. The other reason why they respond very well is an extremely strong vital force. And what do I mean by the vital force? Well, the vital force is the energy of the body. So if there's a lot of energy there, it's easy to get a child at the homeopathic remedy to act as a catalyst to get the child to heal. So I would really encourage you to be aggressive with your remedy kit, with your children, your grandchildren, and you're going to be delighted. All right, so let's look at a couple of childhood illnesses. And of course, these illnesses can be applicable for an adult also. So otitis media, which is an infection of the inner ear, the best treatment is constitutional. But once again, sometimes the constitutional treatment, it takes a lot more effort. And I think that many of you are ready to begin to delve into constitutional treatments. Sometimes there's a fine line between acute and chronic. And as it's true with every disease, the best treatment is constitutional. So in the repertory, and let's turn to the repertory, ear pain, ear inflammation. So let's see if somebody finds the right page, if they want to type it before I do. Ear, let's see, ear pain. There's noises, so okay, ear pain, that's a big section. And then inflammation. Let's see, inflammation, there's pain burning, pain lancinating, let's see, pain pressing, pain stitching, and let's see, pain, pain. Anybody find it? 290. Okay, good. Somebody found it on 290. All right. Okay, great. Inflammation, ear inflammation. So you can see Apis, belladonna, Mercurius is high up there. Mercurius corrosivus, pulsatilla, inflammation of the eustachian tube, inflammation inside, inflammation of the media, and calcarea, sulf, chamomilla, hate bar, and there's the remedies here. So once again, this is a section of the repertory that I don't use very frequently. I'm much more familiar with the eye. Use left ear and right ear as subrubrics. So, these subrubrics are important. And of course, we know that certain homeopathic remedies are strongly left-sided, some are right-sided. And usually the right remedy will work quickly, and the child will fall asleep shortly after taking the remedy. And it's recommended to use a 30C, and you can do this 3 times a day if needed. The key is that if you do the 30C once and you get a positive response, then repeat it whenever the pain seems to come back. If you use a 30C and you have a questionable response, then I would repeat it immediately. Sometimes the energy of the disease just requires more of the homeopathic remedy. It's sucking up the remedy, and you need to use more. Remember, we're trying to get the homeopathic remedy to push the body towards a homeostasis. So the 30C, one dose may not be enough. You may have to repeat it. But the important thing is you should get a positive response. If you don't get any response, then you need to look at a different remedy. And there's are some other methods to use. Ear oil, mullein, which I'm not familiar with, and garlic, and just heat. And it's interesting, there was a study done that antibiotics do little to influence the outcome of otitis media, which was a shocking study. I think they compared antibiotics to homeopathy, and homeopathy was much more successful in treating otitis media. Unfortunately, the pediatricians, as soon as a child comes in with an ear problem, they just immediately will give antibiotics. And I hope that you're understanding now in this course that antibiotics are suppressive. Avoid dairy and smoky environments. And don't lay the baby flat on the back while feeding. Okay, we have heard of belladonna before. And belladonna has been used, at least throughout this course, belladonna has been an acute remedy for many conditions. We talked about belladonna with sore throats, headache, abscesses, etc. And I can't emphasize enough, this is the beauty of homeopathy, that when you understand these homeopathic remedies, they are going to be very effective for many, many different conditions, not just one particular disease of the body. So in belladonna, we have an intense ear infection, bright red flushed cheeks, more on the right. Belladonna, if you remember, characteristically has this 3 p.m. or 3 a.m. Aggravation. There's a throbbing pain, hot head, cold hands and feet, hot temper, but get over it quickly, aggravated motion, jar and warmth, and they have a fever. Chamomilla is another big homeopathic remedy. And the characteristic of chamomilla is that is irritability. Very, very irritable. The nervous system is wound up. And there's this characteristic of capriciousness. The child wants to be carried, but then whenever you do carry them, they're upset. They want to be left alone. They don't want their ear to be touched. It may start after a cold wind, like aconite. Hot feet. This is another really peculiar symptom with chamomilla. One cheek red and the other pale. Anytime you see this, think of chamomilla. And just for fun, let's see if we can find this in the repertory. One cheek red and the other pale. So let's look. Take a couple minutes and let's look for this, okay? And I'm going to start with the face. Okay, so we're on the face. And I'll tell you, I'm not familiar with this particular rubric, but I would look under face discoloration. That's a good place to start. And let's see, discoloration. If anybody finds it, if you could please type it in. Discoloration, lips, forehead, copper colored. So we may want to look under cheek. So there is no cheek. Let's see. There's bluish. So there's face discoloration of the cheeks is chamomile, but I'm not finding something here. Red. Let's see, does anybody have any luck? Okay, 364. You guys are on the ball here. 364. Okay. I don't see one side red, and the other one is 359. Discoloration yellow. Okay, around the eyes. Let's look at 359. Discoloration. Changing colors, dark, dirty, pale. Let's see, pale. Chill during. Okay, any other ideas here? Changing color. You know what? I know there's a rubric. Oh, changing color. Yeah, I see that. So let's look at 359, changing color. But this discoloration is one side is red, the other side is pale, so it's not changing color. But anyway, I'll tell you what I'll do is on break, I'll see if I can find it. Okay. But anyway, you can see as you're reading through the repertory, you can find some interesting symptoms, other rubrics. And once again, I have to emphasize that the best way to learn homeopathy is to go through the repertory. I was talking to one of you during your 30-minute call with me, and when I was a student, what I would do is I would read one chapter in Kent a day. So while I was in the bathroom, they were during those odd moments when you don't have anything to do, I would just pick up a chapter and read through it. Probably the three most important chapters are the mind, and the generalities, and then for me, it's the eye and vision chapter. But mind, you got to know the mind, and you got to know the generalities. Okay, so let's move on here. Hepar sulf. Pain is very severe, sharp, and splinter-like pain. Hepar sulf is a big remedy for abscesses. It's also, remember, we studied this for sore throat too. Chilly and worse cold and cold drafts. Extremely sensitive to cold, averse to being touched, irritable from pain. So you can see that Hepar sulf could very easily be confused with Chamomilla, but for me, Chamomilla tends to be more of an acute, and Hepar sulf tends to be more of a remedy that is kind of like maybe the end stages. Oh wait, somebody typed here 358. 358. They do say cheeks, so let's look at 358. 358 cheeks, discoloration. All right, bluish. I'm looking here, cheeks. Yeah, Chamomilla. That's one that I picked up. If you look on 358, halfway down the right-hand side, discoloration cheeks. But there's a particular rubric that one side red, the other side is pale. So that's the one we got to find. So when we take our break, I'm going to look for it and see if I can find it, and maybe you can look for it too. But I think there's a better one. Okay, Lacus Asst, severe infections with extreme pain. Lacus Asst is a left-sided remedy. Aggravated wind. Jealous and ear infection may come on after the birth of a sibling. And that's interesting because Lacus Asst, if you recall, is a big remedy for jealousy. And of course, what happens when a second child is born into the household, there is, that jealousy. So this is something to keep in mind. And of course, that any condition that develops after jealousy, or an event of jealousy, think of Lacus Asst. Calcarea carb, hearing impairment, thick yellow and offensive discharge. Head is hot and sweats, chronic constipation, throbbing pain in the ear. Every cold leads to an ear infection. This is interesting because Calcarea carbonica has this tendency that they very sensitive to cold weather, dampness, and when you see this, think of Calcarea carbonica. So not only would this be for an ear infection, like every cold leads to rheumatoid arthritis, every cold leads to a lung infection. So this idea of cold. So where do you think we could find this in the repertory? So let's see. I'm going to ask you folks to pull out the repertory, and where could I find this particular symptom? Every cold leads to an ear infection. So I'll give you a hint. You may not find it in the ear section, but I think that you're going to find it in the generality section. So if you come up with some pages, if you could type them here on the right-hand side. Okay, anybody find something? Okay, 1349, great. And you can see there's all sorts of variation. Generalities, cold in general, which starts on page 1348. By cold in general, that means aggravation from cold in general. Then we look at cold ear aggravates, on becoming cold, and heat and cold, cold place entering aggravate, tendency to take cold. And on page 1350, cold wet weather aggravates, and we can see calcareas there, calc phos, docamara. So when you see all those remedies in bold, they're the ones that are strong ones that you need to look at. So this is a great little rubric to remember and keep in the back of your mind. Mercurius vivis, more serious ear infections, have tried everything. And Mercurius is a syphilitic remedy. It's a deeper acting remedy. So these are kids that have not only ear infections, but they're allergic, history of recurrent pharyngitis, bronchitis, sinusitis. They're usually bright, precocious, and observant. They like to play alone, and the other two characteristics of all the mercuries, Mercurius vivis, Mercurius solubus, all the mercuries. Mercurius sulf is drooling at night and heavy perspiration. That seems to be classic for the mercuries. If there's a little bit of drool on the pillow at night, heavy perspiration at night, they also have offensive odor to the breath. All the mercuries are aggravated at night, and it's more often the right ear. Pulsatilla is the number one remedy for ear infections. The child is mild, weepy, whiny, better consolation, which is a little bit different than chamomile. Chamomile, they are not better consolation. They want to be carried, but they're aggravated by the consolation. Pulsatilla, another characteristic of pulsatilla is that they have greenish yellow mucus, a discharge. It seems like that's the nature of pulsatilla. So if you have a nasal infection, pulsatilla nasal infection, you'll get this greenish, yellowish mucus discharge. They hate stuffy, better outside. Typically, a pulsatilla likes the window open. They like to have air on them. They're worse heat. And pulsatilla, they like consolation and they really crave infection. They're the type of kid, do you love me, mommy? And I'm your favorite baby. They just love attention. But it is the number one remedy for ear infections. So if you have a child that has this nature, it's really a no-brainer to prescribe pulsatilla. Silica is also good for chronic ear infections, but the silica is a much different remedy than pulsatilla. Although silica, we were talking about the relationship between remedies. Silica is the chronic of pulsatilla. So what do I mean by that? Sometimes when you treat a pulsatilla constitution, over time they'll turn into a silica constitution. And you may want to say that this is layers, or you're treating more deeply. But in a way, for an acute problem, silica is much different. It tends to be more chronic. They can also have drainage. But the thing is with silica, it's a chilly remedy, and they're aggravated cold, while pulsatilla is a hot remedy, and they're aggravated heat. So if you're treating someone successfully with pulsatilla, and all of a sudden you have this change in temperature modality, they go from being a hot remedy to a cold remedy, that's really critical, and then you would think of silica. So there is somewhat of a tie-in between silica and pulsatilla. Silica also affects the glands. There's like a slowness in their body, so they tire easily, aversion to milk, constipation, skin doesn't heal well, sweaty feet, and it is a very slow-acting remedy. So a lot of times there's a history of slow healing. Maybe after surgery, the incision heals slowly, or they react slowly to any treatment that is silica. So if you do have a otitis media and you treat it with silica, be aware that the remedy is going to be a little bit slower acting, that it may not act as quickly as some of the other homeopathic remedies. Aconite. We've had aconite, I think, just about every lesson. Aconite is a fast-acting remedy, and very hot, painful, throbbing pains after exposure to cold and wind, high fever, dry cough. So aconite can be often confused with belladonna, as belladonna also has a high fever, hypersensitive to noise, and hot and painful, ameliorated warmth. Allium cepa, or the onion, sore throats with pain extending into the ears, tends to be left-sided, aggravated warm rooms, ameliorated cold room, and cold air. So once again, colds that go into the air infection. So similar to Calcarea carbonica, but different modalities. Allium sepia is aggravated warm rooms, while Calcarea is a cold remedy and likes warmth. Burita, muriaticum. The burita are big remedies for glands. So when you see an extremely large swollen gland with otitis media, you would think of Burita muriaticum. Discharges smell like rotten cheese. Aggravated night, lying on the affected side. Causticum, pressing out pains, tearing pains, offensive and bloody discharge, roaring in the ears. So let's see if we can find that in Kent's repertory. A roaring in the ears, roaring. So let's see who comes up with that first. Give me a page number. Okay. Anybody got it? Okay. Anybody have it? Type it. I found it here. $2.99. Great. That's the page. Ear, noises, roaring. And you have quite a list of remedies, but once again, you're going to focus on the bold type, and you can see that causticum is there under bold. You also have right, and you have left. You have daytime, morning, afternoon, evening. In evening, sulfur is there in bold. At night, so good. Good job. Okay. Ferrum phosphoricum, first stages of inflammation with high fever, fairly sudden onset, right-sided, aggravated night, ameliorated cold, application, hearing loss, and crackling noises on blowing the nose. Graphites, rupture of the tympanic membrane, eczema around the ears. Fishy odor from the discharge. So graphites is known for eczema and discharge, classically a yellowish discharge, aversion to sweets. Calibichromicum, conservative kids, and all of the Callies have this thing of being conservative, dogmatic, rigid, no gray areas, either right or wrong. When I was studying the Callies are the ones that would never park near a fire hydrant. They would never park in a handicap parking spot. They would never go through a stop sign or a red light. These are very rigid, conservative, following the rules. So the key with calibochromicum, and put this deep in your mind, is the ropey discharge. Anytime you get a thick, ropey discharge, stringy, that kind of, you can stretch it. Think of calibichromicum. This is a big, big keynote for calibichromicum. So any type of discharge that is thick and ropey. So let's see if we can find this this ropey discharge. So let's see. I think probably the easiest place to find this would be nose discharge. So anybody find it, let me know. I'm looking for it. Okay, nose discoloration, nose discharge. Anybody got it? And I have a nose discharge thick on 332, watery. Let's see, yellowish brown. It might be under thick, purulent. Here, there we go. Okay, somebody found ropey. There's ropey under expectoration. So Todd found that is Calibichromicum. I'm unmuting you. Is Calibichromicum listed there?
Yeah, it's bold.
Okay, great. Because I'm also looking at nose, discharge, viscid, and tough. I didn't find ropey under nose discharge, but I found out in the Calibichromicum is listed. So you'll probably find a Calibichromicum throughout the Materia Medica under that particular, ropey, thick, or discharge. Anybody else find anything? So, okay. Calicarbonicum, that's where the outer ear feels very cold. These are less common remedies. Lycopodium is a right-sided ear infection. Aggravated cold drafts, irritable after awakening, ear discharge, thick, yellow, and burning, digestive symptoms, anxious and insecure. Metaurinum is a chronic history of recurrent sinusitis and rhinitis. Metaurinum are creatures of the night. They sleep on the abdomen. So these are kids that don't like to sleep at night. They're awake all night. Serious otitis media, which is a type of otitis media, and these are the remedies differential for those. So homeopathy is really, really big for otitis media. Those of you that have kids, especially young children or grandchildren, it can be really, really effective. And there's been published studies to show that homeopathy is great. So, um, keep this particular lecture handy if you have kids that are at that age of getting ear infections. Teething. Common symptoms, swelling of the gums, tenderness and pain, droolings, salivation, loss of appetite. Let's see, testing. I just got a indication that there may be a slow internet connection here. So if you can hear me, if you still hear me, if you can just type that I'm still coming through. I'm just being more aware of when we get a poor connection. Sounds okay. Okay. So in terms of using the repertory for this, teeth dentation difficult. So let's get a page number on that. If somebody could give me the page number. Teeth dentation difficult. Anybody got it? And that is on page 431. Teeth dentation difficult. And there's also teeth dentition slow. And there's a lot of similar remedies between dentition difficult and dentition slow. And you can see there's 1, 2, 3, 4 bold remedies in that. Once again, a 30C potency as needed, and also consider the constitutional remedy. Oh, and this is a very interesting rubric. I don't know if this is a mistake. Rectum diarrhea, dentition during. So let's check that out. Let's see if somebody can find the page number for rectum diarrhea. Rectum diarrhea dentition. And does anybody know the homeopathic term when you have symptoms related to different parts of the body? So let's look under rectum diarrhea. Anybody find the page number? Anybody find a page number? It is on page 612. Rectum diarrhea dentition Doring. And I'm going to pick on somebody. Debbie, do you know the homeopathic term for
Yes,
this peculiar combination of symptoms? And what is it?
I don't know.
It's called a concomitant. Concomitant. And this is really important in homeopathy. You may think, what does diarrhea have to do with dentition?
That's what I was
So,
thinking.
what does it have to do? So, this is something that really you should light up when you have a two symptoms that are combined in a peculiar way. And I don't know if there's constipation there during dentition, but this is something that is called a concomitant, which is a symptom which occurs totally unrelated to the primary symptom. Okay. And 30C potency as needed. Okay, somebody typed in 431. Let me see, in 613. Let me see, 431, 6. Okay, 613. I think in my book it's 612. 612, diarrhea, dentition door. And then 431. Let me just check out 431. Okay. Okay, great. Okay. Borax, the child is sensitive to downward motion and extremely sensitive to noise. Borax has this keynote that they're aggravated from downward motion. So, going down steps, if you're carrying a child and you move them downward, this is a really peculiar symptom for borax. When you see it, it's a strong keynote and it should be considered. They cry when they nurse, and it's one of the main remedies for aphthy of the mouth or lesions around the mouth. Calcarea carbonica has slow dentition, slow to learn to stand and walk, perspiration on the head, enlarged heads with delayed closure of the fontanelles, irritability, whiny, and stubborn. Calcarea phosphoricum, tardy dentition, moaning and complaining, restlessness, easy caries, and tooth decay, and ameliorated in the open air, and they have growing pains. So these are a couple remedies for teething. And here's our friend Chamomilla, which is the main teething remedy. Remember, for otitis media, the number one remedy was pulsatilla. For teething, chamomilla. Irritability may hit the parent. Oversensitive to pain, must be carried around quickly to alleviate the suffering. And this is the only way to quiet the child. Often the child will want to be carried and then, even scream when you do pick the child up. This idea of capriciousness. aversion to being touched, whiny, restlessness, inconsolable, trouble making up their mind, diarrhea with teething and green stool, very thirsty with red and tender gums. Pain may extend to the ears, face, and head. But to me, if you have children and they're teething or going through their terrible threes, or is it terrible twos? I'm not sure. Chamomilla is a godsend. You definitely want to have this in your home. Creosotum, severely difficult dentition, worse night, unable to sleep, gums bleed easily, teeth decay as soon as they appear, excoriating diarrhea with undigested food, offensive breath. So let's try to find excoriating diarrhea. Let's see if that symptom exists. So rectum diarrhea. So what you need to do, if excoriation isn't there, then you have to think of another word that may be similar to excoriation. And let's see, I am looking here. Here's the rectum. If anybody finds it, please type it in. Rectum diarrhea. Let's see. Okay, now if it's not in the diarrhea section, it might be in the stool section. So we're going to look in that section. There's dry, difficult. So I don't see anybody find excoriation. Excoriating diarrhea. Now, it may also be under burning. Okay, I found it. It is under stool, acrid, page 635. So look there, it's the first one. Acrid, corrosive, and excoriating. And creosotum is there, but creosotum is not, it's just listed as a 1. It's not an italic or a bold. So this is when you are using the repertory and you can't find a particular word, then begin to look for words that are similar. So I thought burning, but I couldn't find burning. And then corrosive, acrid. Let's see, because there isn't burning, stool burning. It's not, that's not listed. Okay, good. Silica, gums appear blistered and the teeth decay and break easily. Difficult or bashful stool that come out and then recede. Offensive perspiration of the feet and back of the head, teeth appear late. So this is kind of a peculiar. What do they mean by bashful stool? So I don't think we're going to have bashful, but I do think that there might be recede. So we'll look up that. So soft, watery, nothing there. So maybe let's look under rectum. Let's see, pain. It may be under rectum constipation. Let's look under rectum constipation. If anybody finds this bashful, let's see. Okay, we have under constipation, we have ineffectual urging and straining. It might be insufficient, incomplete. That sounds pretty close. Stool remains in the rectum too long. So there might be a better one, but I think ineffectual. To me, the ineffectual urging and straining, or insufficient, incomplete, unsatisfactory. If anybody can find another one. I'm not sure if bashful is actually listed, but this receding, this idea of receding, so I can't find it. Let's see. Standing. So the best way to, study the repertory is to actually, when you do have a peculiar symptom like this, is begin to read the repertory and, use your imagination. Look at each description, look at the remedies, and that's the only way you're going to learn. Sulfur, bright red lips and many eruptions with much itching, worse, night, heat of the bed, sour diarrhea with itching of the anus. Sulfur is a really big remedy for the skin. It's a hot remedy. Red lips, red eruptions, itching, sensitive to heat. Sometimes it's tough to differentiate pulsatilla with sulfur. They tend to be similar in many respects. Hot remedies, skin problems, um, um, itching, ameliorated draft or cold air. But the big differential between sulfur and pulsatilla, pulsatilla likes this consolation. They tend to be weepy. Sulfur tends to have a stronger ego, more independent, could care less about consolation, more independent, more intellectual than more than emotional, like pulsatilla. Okay, any questions on material that we covered so far? And has anybody had any experience on treating any of these conditions that we covered? So if you have had any experience, give me either raise your hand or type in a question. Anybody have any experience? Okay. Of course, many of you don't have kids, but if you do have kids or grandchildren, definitely begin to look at these remedies. Okay, now let's look at colic, which can be a big problem in children. Paroxysmal abdominal pain of intestinal origin with severe crying. Crying distended to the abdomen. Some causes are swallowing air during feeding, overfeeding, etc. Prevention is the right feeding techniques, elimination of food that have allergens. And then here are the common rubrics. And let's see if we can find abdominal pain, cramping after milk. Okay, let's see if we can find. Of course, this can be a symptom that would be present not only for children, but also adults. So I have abdominal pain. We look in the abdominal section, pain. We're going to find cramping. As soon as somebody gets a page, let me know. Abdominal pain, aching. There's the time modalities. Let's see. Constipation, abdominal pain, exercise. Bending, chill, cold. I don't find it. Cramping, abdominal pain, cramping. Anybody find it? How about abdominal pain? Anybody find it? Oh, 559. Good. 559. Abdominal pain. After milk. Very good. And that's on page 559. Abdominal pain after milk. And then, of course, you can also find it in the stomach section under food. Let's see, stomach. Okay, stomach aversions, stomach aggravations. I think it's under stomach aggravations. Aversions. But it's also in the stomach section. Some of the newer repertories have it in the generality section. Okay, anisatum, which is a plant colic that occurs at regular periods with rumbling of the abdomen, pain in the ribs on the right side. Cholesynthesis, agonizing pains in the abdomen, causing the patient to bend over double and press the abdomen. And this is a remedy that I've used many times. Cholesynthesis, I haven't used anisatum. I'm not familiar with that remedy, but cholesynthesis seems to be a big remedy for abdominal pain, especially when the patient bends over double and putting pressure on the abdomen. Chamomilla, once again, we've seen that remedy before. Distress after nursing, irritability, peevish, never satisfied, ameliorated being carried, flushed cheeks. That flush, that may be something on break. I'm gonna look it up. Red and then white. It could be flushed. Maybe that's why we didn't find it. Senna is even more irritable than chamomilla. Pain at the fixed point above the navel. Ameliorated pressure. Child may lie in a knee chest position to alleviate the pain, or likes to be draped over the shoulder. So also has this amelioration pressure. Abdomen is bloated and hard, aversion to mother's milk. Magnesium phosphoricum, much flatulence, withdrawing up of the legs, ameliorated warmth and bending double. Magnesium phosphoricum, all the magnesiums are pains for spasm. So magnesium phosphoricum can be a remedy that is used for, writer's cramps, pains in the calf at night, so spasms. Thrush is a fungal infection in children in their mouth, white discoloration. Borax, the child may let go of the nipple while nursing and show signs of pain, frequent epithy salivation, red blisters, fear of downward motion. As I mentioned, babies are clinging and dislike strangers. Kali Muir is a big remedy for thrush, white ulcers in the mouth, swollen glands, grayish white coating of the tongue, which can be slimy, also accompanied by chronic catarrh of the nose or middle ear. I think, in my experience, is the mercuries are big for thrush, white ulcers in the mouth, and once again, the whole mercury family, the mercury remedies have this copious salivation, inflammation of the whole mouth, foul odor and ulcers, swollen glands with much diarrhea. Now let's look at skin infections, skin viral infections, and we'll begin with measles, caused by a virus, highly contagious disease. Generally, exposures provide permanent immunity. Symptoms, cold symptoms, dry cough, irritated eyes, Koplik spots in the mouth are characteristic red ulcerated lesions in the mouth with the measles. Complications with the measles include ear infections, bronchitis, pneumonia, encephalitis, febrile conditions. Epidemics occurring in full vaccinated population, diseases in older adults. That homeopathy is extremely effective for treating measles. There's just a lot of good evidence in the homeopathic literature historically, before vaccinations and other treatments. Because it's a virus, antibiotics are not effective for this. And I believe that homeopathy can prevent the contagious nature of the disease. So if there is a measles epidemic or if the measles occurs in school, we talked about the genus Epidemicus earlier, that every infection has certain characteristics. So even though there are many remedies for measles, once you find the genus Epidemicus, this can be a prevention. So I know many of you may not be interested in measles. Maybe you don't have kids, but remember, measles can occur in adults, and the methodology and techniques that you learn for treating these viral infections can be applicable for the treatment of all viral infections, including the influenza, colds and flus, and other more serious viral infections. So, measles remedy. The number one remedy is aconite. And we've heard of aconite before in terms of treatment of influenza, colds and flus, and injury, eye infection, etc. Early onset high fever, there's this restlessness, photophobia, nosebleeds, dry hacking, croupy cough, stitchy pain, grinding the teeth, anxiety and agitation with a great fear of death. And that seems to be what differentiates aconite from belladonna. There tends to be more anxiety and agitation with this peculiar fear of death. There's a rubric in the repertory that is something to the effect, has so much anxiety, they predict the time of death. In other words, they're so sick, they're so scared, they just know that they're going to die that day or that night. Apis mellifica, or the honeybee, is useful when the eruptions become confluent with much edema. So the characteristic of apis is edema. Greatly inflamed eyes, and a croup cough, which is violent and associated with diarrhea. So the differentiation here is that the aconite does not have as much edema, and they have more of a croupy cough. A croupy cough is more of a wet cough compared to the dry hacking cough of aconite. Baronia is a slow onset dry hacking cough, painful cough, rheumatic complaints, and constipation, irritability, thirsty. Baronia is very, very thirsty. And the thing about Baronia is movement aggravates. So the cough is painful because when they cough,
It causes a vibration in the body, which causes pain. Aggravation movement, any movement in the extreme Borrelia situation is even someone sitting at the bedside and causing some movement or disturbance of the bed will cause a aggravation. So whenever you see this sensitivity to movement, think of Borrelia. Euphrasia is a big eye remedy. It's also called eye bright. And so in measles, they predominantly have eye symptoms with profuse, acrid, burning tears and a bland nasal discharge. And remember, we talked about the differential between euphrasia and allium cepa. Allium cepa also has tearing and a nasal discharge, but it's just the opposite. Euphrasia has the acrid tears, bland nasal. Allium cepa has the bland tears and acrid nasal discharge. So sometimes you can actually see this on inspection. If someone has a nasal discharge and tearing, you look below the eyes and below the nose. And if one area is extremely red, that can be a quick differential. So if you're glancing at a face and they have discharge from the eyes and nose, and there's a lot of redness and excoriation below the eyes where the tearing is, that means it's acrid nasal, it's euphrasia. And if it's the opposite, where it's red and inflamed below the nose, allium cepa. So that's a quick way of differentiating these two remedies. Morbillium is the measles nosode. And this, in homeopathy, we often use the nosode as a prophylactic treatment, much like vaccination. But this particular remedy is used for complications of the measles vaccine. So if someone does receive the measles vaccine and has side effects, whatever they are, there are many complications from vaccines, consider this. Pulsatilla, milder cases and later stages, and it's useful for sequelae like headaches, eye symptoms, enuresis, or hearing impairment, not as useful as when there is a high fever. So remember, pulsatilla is for milder cases and later stages. And once again, the pulsatilla has some characteristics, mental and emotional features that make it easily recognizable. They like consolation. They tend to be sweet. Generally speaking, the cough is loose and productive. Eruptions and mucus are thick and green, although they can have a dry cough at night that is loose during the day. Sulfur is another big remedy for measles. It's useful early or late in the course of the measles. And remember, with sulfur, it tends to be more affinity to the skin. So maybe more of a deeper rash. There's a purplish rash. And sulfur has this characteristic of a lingering on, this dirty, unhealthy look, unbathed look, a lot of odor and smelling. And sometimes some homeopathic remedies feel that sulfur is the clearing remedy. So in other words, you're treating the measles. Some of the early remedies respond well, and then sulfur is finally given to clear the remedy or clear the condition. And Hahnemann taught that sulfur was the number one remedy, that we're all sulfur to a certain extent. And because all disease started with the sora miasm, that eventually all of us will need sulfur. Okay, questions on measles. Okay, now we're going to move on to mumps. Mumps is another viral infection that affects the salivary glands. Fever, headache, fatigue, earache can be infectious for 6 days. Complications of mumps can be severe, including encephalitis, pancreatitis, inflammation of the testes and ovaries. But since the vaccine, the mumps vaccine, which all children receive, disease is more common in adolescents and adults. So be aware of this, especially in adults. And the rubrics that we look at are face swelling of the parotid gland, face inflammation of the parotid gland. So let's see if we can find this. If you want to look up in your repertory and give me a page number on this. I hope everybody has their repertory with them. Face swelling. Let's see here. Face paralysis, perspiration. Not having any luck. I'm on pain here. Perspiration, sensitivity. Aha. You guys beat me. 393. Face swelling of the cheeks, face swelling of the lips. Let's see. I still can't find parotid. Here we are. 394. Face swelling of the parotid gland. And we have left, we have hard, we have right, sublingual, maxillary gland. So this is a good section of your repertory. Okay, mumps remedy. And belladonna is our old friend. We've seen it for many, many conditions. Typical belladonna symptoms. And so I'm going to call on somebody. Okay, Todd, what are the typical belladonna symptoms? Hello, Todd?
Oh, just coming in here.
Okay, what are the typical belladonna symptoms?
As far as
In mumps, belladonna is a homeopathic remedy we've seen over and over again. What are the typical?
like heat or redness.
Very good. Heat, redness. How about the pace of belladonna? Is it a slow onset or a quick onset?
No, quick.
Quick. Very good. And heat, you covered the heat. Swelling. Anything else? Does anybody else have any ideas on belladonna? You can either raise your hand or type in a response. Very good, Todd. But, you got to know belladonna because belladonna is a remedy that can affect many, many different conditions. We saw it for otitis media, we saw it for sore throats, and now we're seeing it for mumps.
Throughout the nervous system.
Yeah, irritability. And they tend to crave what type of drink? Does anybody know? Characteristic feature of belladonna. They crave a certain drink.
I would think
Anybody?
cold, but
They crave lemonade. And it was interesting when I had my last flu and I had a high fever, I just had this weird craving for lemonade. I don't know if it was just because I remembered belladonna, my studies of belladonna, or it was actually there, but sometimes you'll see that craving and belladonna is also a right-sided remedy, and they can have extremely high fever, Jabarandi, bright red face, much sweat and thirst. This is a parasympathetic acting homeopathic remedy. Excess salivation, parasympathetic stimulation. So think of Jabarindi when the swelling of the parotid may subside and then go to the testicles or breast. Mercurius vivus, aggravated night, the right side, putrid taste, and the characteristics of all the mercuries, foul breath, much perspiration, and extreme salivation. Perspiration at night, they're definitely worse at night. Foul breath, perspiration, extreme salivation. So no matter what condition you have and you have these characteristics, you think of the mercury family. Paradinium is the nosode of mumps, and once again in homeopathy we have nosodes, which is the actual disease made in homeopathic preparation. And once again, this is for the complications, the consequences of the mumps vaccine. So if you do have a child that receives the mumps vaccination and has sequelae, side effects, and you're not sure what remedy to use, paradinium is the mumps nosode. Phytolacta, stony hard swelling of the parotid glands and inflammation of the maxillary glands. And we had studied phytolacta previously when we were studying different breast conditions, stony hard glands of the breast, problems with mastitis. And I have used phytolacta successively with some of my goats, and it helped to treat their mastitis. Pilocarpus is the alkaloid obtained from the jabarande, and for the eye doctors that are attending the class, we know pilocarpine, parasympathetic drug, and it's also used for prophylactically in complications of encephalitis or orchitis. Pulsatilla is lingering mumps, tendency for testicular swelling, ovarian swelling, breast swelling, worse on the right, plus typical pulsatilla characteristics, which are weepy, liking consolation, very hot remedy. They like cool air. They have discharges, etc. So, we've seen pulsatilla over and over again. It seems like every condition we study, pulsatilla comes up. So, these are major polycrests, which you really need to know and you need to become familiar with. Okay, questions on mumps. Anybody have questions on mumps? Questions on what we've studied so far? Okay, now we're going to move to rubella. It's another childhood illness that's extremely infectious. Fever, swollen glands, a fine rash on the face, tiredness for several days. Rubella during pregnancy may cause birth defects in 20 to 50% of babies. Complications are encephalitis, meningitis, Guillain-Barré syndrome, which is a neurological condition of paralysis, may develop chronic arthritis, which seems to be more common from the vaccine. And in the repertory, skin eruption, rubella. And let's open up the repertory. because that skin eruption is a extremely important section of the repertory. So let's see if we can come up with a page number on that. And I hope all of you that your repertories are becoming tattered. The pages are thin from turning them repeatedly. I hope I never meet any of you and your Ken's repertory look like it's a brand new book. You know, you can always tell a good experienced homeopath when you look at their copy of Kent's and the pages are just falling apart and pulling. So it's a big section, eruptions. It starts on page 1308. And the first thing that strikes out to me, eruptions alternating with dysentery. Russ talks, alternating with diarrhea, alternating with tightness of the chest. Respiratory symptoms, asthma, internal affections. Remember, we talked about these concomitants, and so they're pretty prominent. There's biting eruptions, blotches, blisters, itching, burning eruptions, and trying to find painful eruptions, patches. Anybody find rubella? Eruptions, rubella, pustules. Okay. Nobody? Let's see. Scabies, roseola, red. I don't have pustules. Red. Okay, it's there somewhere. I can't find it either. Anybody find it? There's roseola, rupia, eruption, scabies. Nope, I don't find it. Don't find it. I'll have to check a little later. Okay, unless, and I'm not sure, maybe it's rubeola. It's under rubeola for skin eruptions. That could be instead of rubella. Roseola. On page 1312, roseola. Maybe they're calling that rubella. I'm not sure. It could be the same thing. So the main remedies are aconite, belladonna, boronia, and pulsatilla, and all these remedies are, should be familiar to all of us. No, roseola is different, but roseola, we have skin eruptions, roseola. I don't know where rubella is. I'll have to see if I can find it on break. I'm going to look up on our break. I'm going to look up where we can find rubella and this idea of cheek, red, and pale. So that's going to be my assignment on break. Roseola, a viral infection of children between 6 months and 3 years, high fever, following by swollen neck glands. Symptoms last about a week. And we did find skin eruptions, roseola. Main remedies are aconite, belladonna, boronia, and pulsatilla. Chicken pox is another very common childhood disease. And when the children get chicken pox, it generally provides permanent immunity after illness, incubation period 2 to 3 weeks. Rashes small, flat, and pink, clear fluid, a prominent face, scalp, and trunk. Complications include secondary infection of the skin, encephalitis, Ray's syndrome, convulsions. Pregnant mothers have a high risk of birth malformations. Skin eruptions, chicken pox. Let's see if we can find that. Skin eruptions. Okay, eruptions, chicken pox, and I got it. Anybody find it? Skin eruptions, chickenpox. If you find a page number, type it in for me. 1310, excellent. Left-hand column, chickenpox, and aconite, antimonium crudum, antimonium tartaricum, arsenicum, acidophilus, belladonna, etc., etc. But the big ones are pulsatilla, sulfur, shingles, skin eruptions, zoster, sane remedies for chickenpox, plus consider ranunculus bulbosa, meserium, and iris versicolor. So if we look under skin eruptions, zoster, skin eruptions, zoster. Let's see, zoster. Anybody find it? Herpetic 1313, very good. So we'll turn to page 1313. Excellent. Skin eruptions, herpetic, zoster zona. And you can see meserium, ranunculus bulbosa. And these remedies here are really, really important for post-herpetic pain. So, those of you that are practicing eye doctors, herpes zoster is becoming more and more prominent. We're seeing a lot more of it. And I believe this is due to a relationship with the, vaccinations and a suppression. The chickenpox virus lays dormant, and then it comes alive, and it can cause really, really severe pain. So this particular rubric and the remedies can be very valuable for the treatment of herpetic problems. Antimonium crudum, thick-coated white tongue, nausea and vomiting. They don't like to be looked at or touched, very irritable, thick mucus rattling cough. Ammonium tartaricum, large blisters, whining, don't want to be touched, eruptions, delayed. And the characteristic of an ammonium tartaricum, they have a rattling, loose wheezing cough, more respiratory problems, bronchitis, pneumonia. Mercurius vivus, all the mercuries have that intense salivation, worse at night, offensive discharge, bad breath. We know pulsatilla, mild weepy children, thirstless, worse heat, better open air. So, many of these remedies we had before. So, in homeopathy, when you know your constitutional remedies, your big polycrest remedies, you're going to be able to apply them to many, many disease states. And that's one of the things I really like about homeopathy. When you know a remedy, it can be applicable to many disease. So it's not like there's just one particular remedy for chickenpox compared to rubella or roseola. If you know the polycrest, you'll be able to apply them to many different conditions. Rus tox, vesicles that are red, hot, itching, and burning. Restless and worse at rest. These are people that have a certain stiffness. They like to move around. They're better moving, so they're worse when they're immobile. And of course, they can't get comfortable. The bed is irritable, too hard. They just can't get comfortable. And they have a characteristic red triangle at the tip of the tongue. Sulfur, severe itching, worse at night, in bed, worse with heat. So sulfur is a really big skin remedy. They're worse at heat, worse night, worse heat, moist eruptions, and they're very, very hot, very, very hot remedies. Let's move on to scarlet fever. It used to be far more severe. Now it is mostly a fever and strep throat with a rash. So skin eruptions, scarlatine, fever eruptions, xanthomatous. Main remedy is belladonna with a strawberry tongue and a bright red face. Smallpox, not much of an issue any longer, similar to chickenpox, but we need to be aware of this because of bioterrorism. We can find this under skin eruptions, smallpox, and fever eruptive xanthanamatous. So let's look under that one. Fever eruptive, because that's one rubric that we haven't really dealt with. So let's look at the fever section. And this is a section that, let's see, it's near the chill fever. It's after chill. The fever section starts on page 1278. So fever eruptive, fever evening. We have the time modalities alternating, catarrhal, coughing, drinking, and here we have eating. Here, exanthematic fevers, which is on page 1286. And this is the section for fever for measles. And let's see, I don't see the eruptive section. That may be an error, fever eruptive. But I do see the exanthematous. Okay. All right. Antimonium crudum, often diarrhea associated with the smallpox, violent burning and stinging. Eruptions are particularly prominent in the anus and genitals, thick-coated white tongue, don't like to be looked at or touched, irritable, have a thick mucosy rattling cough. That's antimonium crudum. Antimonium tartaricum, more useful in the earlier stages, larger blisters, whining, and once again the antimonium tartaricum tends to have more pulmonary problems, bronchitis, and they have the classic rattling, loose, weaving cough. Someone asked a question, do you have a favorite herpes zoster ophthalmicus remedy? And the two remedies that I really look at are Ranunculus bulbosa and Miserium, and also Rus tox. So you need to look at the subtle differential with each one of them, and you can read those in Borax. But those are the big three. So, but theoretically, it could be any one of those remedies, but I have had success in treating zoster, in particular post, zoster pain, the neuralgia, which can be extremely painful. Homeopathy can be helpful. Mercurius vivus, vesicle suppurative, or there's intense salivation, violent inflammation, ulcerated throat, green discharges worse at night. Remember all the mercuries, the salivation, worse at night, irritable, they tend to be violent, ulcerations. Pulsatilla, tendency for the pustules to become confluent, accompanied with nausea and vomiting. And these are mild, weepy, clingy people, thirstless, aggravated heat. Pulsatilla loves the open air. They love to have the windows open, to have a fan on, to have circulating air. Smallpox remedies also Rus tox, restless, red triangle at the tip of the tongue, as we covered. Sarracenia purpura. It's useful for the worst forms of smallpox, can help abort an infection. Sarracenia purpura. Sulfur, late stages, slow recovery, aggravated night in bed because of the heat. Thuya is useful for the fevers of smallpox, indicated when the pustules are very large. Side effects of the smallpox vaccine. Thuya is the #1 remedy to consider from any side effect of vaccine. It's the #1 homeopathic remedy. So anytime you get a vaccination or an immunization and you do have a problem, consider Thuya. Oh, I think that this was, Debbie, you wanted me to repeat something. Let me go back to unmute you. Debbie?
Yes, you said there was three go-to remedies for cold sores, and one of them was rust.
No,
and I
no.
didn't get the other two.
No, this is not cold sores. This is herpes zoster.
Oh,
Zoster,
gotcha.
zoster is different than simplex. Zoster
Yes.
is related to the chickenpox virus, and it usually affects a nerve root. It can be on one side of the face. It can be on one side of the body. Extremely painful. But the three remedies were ranunculus bulbosa, Miserium, and rust tox. Those are the three remedies that I have experience with. But of course, in that particular rubric in Kent's repertory, any one of those can be possible depending on the manifestation.
Okay.
So Thuya, as I mentioned, always think it's Thuya from side effects to any vaccination. Okay, fever. It's a large section in the repertory. It's probably a section that I do not use that frequently, and other homeopathic doctors feel that it's confusing. Some terms which you need to know is hectic fevers. Refers to the continual fever of tuberculosis. That's hectic. Puerperal fever is a fever after delivery. Zymotic fever is a fever due to infectious disease like whooping cough or measles. So you'll see that in the fever section. And kids respond very well to homeopathic remedies for fever. Just for fun, let's look up puerperal, which is the fever related to after delivery. And that is on page 1289, puerperal fever. And you can see many of the remedies are our old friends that we already know. There's a fever perspiration is on that page. There's on page 1288, fever menses, before menses, during menses. So not only can you find some of these homeopathic symptoms in the fever section, but they're probably in the female genitalia section. Fever sleep coming on, fever stool, before stool. So whenever you do have a patient, client with a fever and it's associated with some condition, look in that particular section of Kent's repertory. Okay. Aconite, and we have seen aconite over and over again. Fever is sudden, usually after chill or cold wind. Exertion or exercise comes on before midnight. And aconite has strong fear of death. One cheek pale and one red, and my assignment is to try to find out the rubric for that. One cheek pale and one cheek red. And when we take our break, maybe some of you can kind of try to find that too. Arsenicum, fever occurs after midnight. Arsenicum has this unique time modality after midnight. So anybody that has a particular symptom that occurs after midnight, usually 1 a.m., whatever the symptom is, think of arsenicum. And where would we find that in the repertory? Anybody know? If you do know, raise your hand. So any thoughts? Let's see. Hey, Craig, any thoughts on where we might find it in the repertory? What section? I don't know if you hear me, Craig.
What was that?
Where in the repertory would we find this 1 a.m. aggravation? Any idea?
Generalities time?
Yeah, generalities, and let's try to find it. I want everybody to tell me where it begins, the time modalities, but that's where you find it in the generalities section. And as I mentioned, the generalities next to the mind is probably one of the most important sections. And you got to read the whole entire generalities chapter. And here we go. You open it up, morning, and it gives you different times, 11 a.m. Of course, we don't want morning. We want, there's afternoon, evening, night. Let's see. Morning, noon, afternoon, 11 a.m. Let's see, night, 11 p.m., midnight, before midnight, after midnight. All right, I'm looking on page 1343. And you can see midnight, before, midnight, after. There's a bunch of remedies. One, ameliorated after midnight is lycopodium, but we want aggravation in 1 a.m., arsenicum in bold. You can see 2 a.m., 2 to 4, and 3 is kali carbonica. So kali carbonica is a big, big remedy for people that have that aggravation in the middle of the night or early morning, 2 to 4. But see, arsenicum up there is bold, 1 a.m. So remember that. The beginning of the generalities chapter is where you have your time aggravations. So it's an important location because every time you do take a homeopathic case, you want to always ask the question, when are your symptoms worse? When are they better? And that time aggravation will sometimes be very, very helpful in selecting a remedy. The other thing about arsenicum, they have a lot of anxiety. They have fears too and restlessness, but not as much fears as aconite. Aconite is extremely fearful, especially that of death. Baptisia, high fever with confusion. Unable to get comfortable due to soreness and bruising all over the body. So the baptisia has that illusion that the bed is too hard. Belladonna, we've seen belladonna over and over again. Bright red cheeks, dilated pupils, dry mouth, hot head. Belladonna has a 3 p.m., 3 a.m. aggravation. And since we were talking about generalities time, let's see if anybody can find the belladonna. So we were looking at, so let's look at generalities afternoon. And I'll be darned, page 1342, belladonna has a 3 p.m. And I don't see it in 3 a.m. I don't see it there, but it has a 3 p.m., but it's been reported to have a 3 p.m. and a 3 a.m. But if you look at night on 1343, 3 a.m., belladonna is not there, but it's a bold at 3 p.m. Also, Lycopodium, 4 p.m. Lycopodium is very classic. Lycopodium begins to get tired and exhausted at 4 p.m. late in the afternoon. Baronia, slow onset, fever is not as high. Meningitis, they can have motion in the jaw side to side, quite thirsty. Baronia is probably one of our thirstiest remedy. They just can't quench their thirst. Ferrum phos, early stages of fever with no individuating characteristics. Usually I think of Ferrum phos with the cold, where, you know, it's an early cold or flu, fever, but nothing really classic that can point to a particular remedy. I usually will consider giving Ferrum phos. And the Ferrum phos is also thirsty for cold drinks. Pyrogenium is a nosode made from pus. Sepsis with high fever, very sick and restless. For infections of the uterus, pulse is low despite the high fever. Rus tox, fever comes on at 10 a.m. So let's see if we have that in our repertory. So it's not there in Generalities, 1341, 10 a.m. But where else might we find fever coming on at 10 a.m. besides the Generalities section? Anybody want to, let's see, hey, Todd, you want to take a guess where we might find?
Probably under fever.
Okay, yeah, let's look in fever. So, you know, you look at Generalities and you can look at, is it there?
1278.
Okay, excellent. Yeah, Rus tox is a bold. So I'm impressed with you folks. You're getting a little bit more comfortable with the repertory. And the repertory is amazing. And, you know, the more you use it, the more you become familiar with, you know, what's available there. You can quickly locate some gems that'll help you find the right remedy. A Rus tox is chilly, aggravated cold, and damp. They have that characteristic stiffness where they like to move, they're restless. Stramonium is similar to belladonna, violent, temperatures, convulsions, and as a strong predilection for the nervous system. Okay, so what we're going to do now is take a break, and we're going to be back in 1 hour. And because I'm recording this, what I'm going to do is turn off or log off rather. So whenever you're going to have to log back on. Okay, so I just don't have to record all this. Any questions before we take a break? But anyway, I'm really impressed. I think all of you are getting a little bit more comfortable with the repertory, and of course that was one of the goals, you know, of the class, to get you comfortable. I can remember our first class, how scary the repertory was. Now you're starting to pick up some gems, which are great. Okay, I'm going to leave, and we'll be back in an hour. See everybody later.